Hi, I'm Dr. Joe Kaushik, andrologist practicing at Cleveland Hospital, Nagarkoil. So basically, we are specialized in penile implant surgery. So today, I'm going to discuss about the most commonly asked questions from my practice. What will be the results? The first question is how much pain we will have during the penile implant surgery. So the penile implant surgery is done under local anesthesia, which means the sensation to the penis is reduced, or the we'll give a spinal regional anesthesia so that the sensation below your spinal cord you will not feel any pain. So usually this anesthetic effect will be there for around 6 to 8 hours post surgery. So followed by that we give injectable analgesics for you to not experience any pain. So this will be the first day of the surgery, and from the second day onwards, you will be shifted to oral medications. For that means you will be given oral painkillers. With that only, you will be able to manage the pain. So in total, any amount of pain, any mild amount of pain also, that will be maximum you will be having till 1 week. Certain patients they might have for around 2 weeks, but the most common people might have pain for a period of 1 week. The next question is when can I return to my work? So it basically depends upon your work. So usually in the penile implant surgery, from the day 2 onwards, you will be able to do all your sedentary works. Sedentary work in the sense if you're a software engineer or if you are a bank manager or something, you can resume your work from the third day of the surgery. But if you're having a manual work or heavy weightlifting, we always advise you to resume the work after 5 days of the surgery. What are my restrictions? So restrictions for a penile implant surgery, there is no major restrictions, but you will not be allowed to shower or bath for 3 to 4 days after the surgery. And regarding the lifting heavy weights or doing heavy workouts, it's always advisable to start doing those works after 2 weeks. If you're a manual laborer or anything like that, you can resume your work after 5 to 7 days. And during that time, you can start to lift weights as we are not opening your peritoneal cavity. The implant is just placed in the corpora. So there will not be any chances of extrusion when the intra-abdominal pressure increases. So when can I shower or bath? So in my practice, I always advise my patients to shower after minimum 3 days of the surgery. So usually in the post-op day 4 or in the post-op day 5, we ask them to shower based on their medical conditions. So if the patient is diabetic or he is having some comorbid diseases, then we ask them to shower on day 5 to prevent any chances of infection, as we want the wound area to be dry. So what I personally do is I put a waterproof dressing so that when the patient wants to use the washroom also, even if there is a spillage of water, it will not enter into the wound area. So it is always advisable to take shower 3 to 4 days after the surgery. So what pills will I need to take after the implant surgery? Usually we give you medications like oral antibiotics and we give you medications for your pain. So these are the mandatory things you should follow after the surgery. Usually it is given for a period of around 10 days to minimize the risk of any infection followed by the surgery. The oral analgesics, it can be reduced from day 5 onwards, because after day 5 you will not feel any much pain and there will not be much necessity for you to take any painkillers. When can I use the device? Usually after the implant surgery. In case of the malleable implant, we always advise you to use the device after 6 weeks, because we want the pseudo capsule to get formed inside your corpora over the penile implant. If you are having an inflatable penile implant, then we suggest you to use the device after 6 to 8 weeks, but you can start the inflation and deflation 1 week after the surgery so that the proper corporal stretching will happen, so that you can get a very good length followed by the surgery. So when you want to meet the doctor again. So usually in this sitting, in my scenario, usually the patients come for me for the surgery and they go back to their home. And in most of the cases, we use non-observable sutures, so that will be removed at their place. So in certain scenario, if the patient is traveling abroad, then we use observable sutures, so there will not be any necessity of removing the sutures. So in case of follow-up, if the patient is not having any complications or any difficulties, then there is no need to visit us again. But if there is any pain or swelling, anything, any signs of infection, they have to call us immediately and we will ask them to come and meet us. What do I need to watch out for? So the first and the foremost complication of the penile implant is the infection. So we have to watch the signs of infection. The signs of infection include any swelling over the penile implant with pain and tenderness and any fever, all those things, or any discharge from the penile site or the incision site. These are all the warning signs you should keep in your mind when you are undergoing the penile implant surgery. So usually we discuss about this warning signs to all of our patients for them to immediately contact us so that we can cure the infection.